Barry, welcome. Talk to me, if you would, about the current state of healthcare in the US right now.
When I think about the current state of healthcare in the U.S., the words that come to mind for me are cautious optimism. Um, Optimism because as a healthcare industry, there's tremendous unmet needs to get after, whether that's cancer, whether that's obesity, whether that's, neurodegenerative disorders. And I think there's a growing recognition of society of the critical role that pharmaceutical companies, med tech companies, doctors, hospitals play in trying to get after that unmet need. So optimism around, innovations for clinical value as well as economic value.
What do you think, with all of that in mind, will be the key trends and themes of 2025 when it comes to healthcare?
First thing that comes to mind is M&A. It feels like we're going to see an uptick in tuck-in M&A from our pharmaceutical and med tech clients, as well as some openness to more transformative M&A. I also expect some M&A, continued M&A in the payer and provider sector. So M&A for sure. A second trend that I think about, I mentioned sort of innovating for value, and I think we're all really comfortable with clinical value, meaning like I'm going to work to extend life or to reduce disability. I think we're seeing a trend around what we will call economic value, which is think about workflow. So not just does this surgery save your life, but can I do this surgery faster? Can I do it more efficiently? Can I do it with less labor? Can I do it with less resource? And so I think innovation for both clinical and economic value is something that we're going to continue to see efforts on in 2025.
What should be top of mind for leaders, industry leaders right now, do you think?
As BCG, sometimes we'll talk about the head, the heart, and the hands. And I feel like that kind of resonates with me. The head being, as a leader, what's your vision? What's the big rocks that you're trying to go after in 2025? The heart, really inspiring and empowering your people, both your employees as well as your customers and the patients that you're serving. And then the hands, meaning getting after it and doing it. So not just being up in the clouds, but actually being at the rock face where activity is happening with customers.
Barry, thank you so much for your time.